Hello friends, let us now discuss the cervical fascia and the different layers of this fascia. Now this topic is very important from the ENT point of view because just after we know this topic, we can understand the different spaces in the head and neck region. Okay, so let us discuss the cervical fascia. Now the cervical fascia is having two layers. Which are those two layers? The superficial layer and the deep layer. Okay, the deep layer we further divide into three more layers. Okay, so the deep layer is divided into the superficial layer, the middle layer and the deep layer. Right, now we are going to discuss each of these layers one by one. So let's first start with the superficial layer of cervical fascia. Okay, so that's known as cervicocephalic fascia. All right, cervico, neck, cephalic, head. Okay, so cervicocephalic fascia, this fascia lies just below the skin. Right, so this fascia is a fascia just below the skin. You can see over here in the neck we have the platysma. Right, you see there is the platysma muscle. On this platysma muscle we have the cervical fascia superficial layer. Okay, now this fascia is covering the whole of the neck and the head region. This fascia is not very important for us. Okay, so we'll go ahead and we will go ahead and see the deep fascia, the deep cervical fascia. Now, the deep cervical fascia is further, as I was telling you, divided into three layers: superficial layer, middle layer and deep layer. So let's first start with the superficial layer of deep cervical fascia. The superficial layer of deep cervical fascia covers the neck all around. Okay, so it covers the neck all around. So therefore, this fascia is also known as enveloping layer, okay, or the external most layer or the investing layer. Right, so anterior layer, enveloping layer, external layer, investing layer, different names given to this fascia, the superficial layer of deep cervical fascia. Let's look at this photograph. This is an axial cross section of the neck. Okay, so it's an axial cross section of the neck, and we'll discuss this photograph one by one in the different layers of the deep cervical fascia so that you have a complete understanding. Now let's look at this image, and we can see over here, this is the investing fascia or the superficial layer of deep cervical fascia. So as you can see that this superficial layer of deep cervical fascia, it is going all around the neck. You see, it is going all around the neck. Now when you see that it is going all around the neck, you can see that this fascia, it is enveloping two muscles. So it is known as enveloping layer. Okay, so it is enveloping two muscles. Which two muscles? It is enveloping over here the sternocleidomastoid muscle, and you can see the trapezius posteriorly. So the trapezius and the SCM, they are enclosed in this fascia, that is the investing fascia or the superficial layer of deep cervical fascia. Now look carefully, anteriorly you will see the platysma. Okay, now you will see the platysma. Remember, this fascia is deep to the platysma. Okay, it is in the subplatysmal layer. Remember, I told you just before this that the superior to platysma, or I can say the superficial to platysma, just below the skin, this was the superficial, okay, that was the superficial cervical fascia. Okay, that was a superficial cervical fascia just below the skin, and below that we had the platysma. Now below the platysma we have the superficial layer of deep cervical fascia. So this is the subplatysmal plane where whenever we have to operate, okay, so whenever we operate and do any neck surgery such as a thyroid surgery, all right, or the lymph node surgeries, so we have to do a radical neck dissection or a modified radical neck dissection, we always carry out, we raise our flaps, the skin flap, in the subplatysmal plane. Subplatysmal plane means that we are operating in the superficial layer of deep cervical fascia, right? Okay, so let's look at this fascia. Now, before I go ahead, let's look over here. Now, this space that I have marked is the posterior triangle of the neck. And what do you see? What do you see over here? You see that the superficial layer of deep cervical fascia, it is forming the lateral aspect, we also call it as the roof of the posterior triangle of the neck. Okay, so you can clearly see that the roof or the lateral aspect of the posterior triangle of neck is formed by superficial layer of deep cervical fascia. The floor is formed by another fascia that we will discuss later. Right? So the floor is formed by another fascia. We'll discuss that later. But remember, the roof is formed by the superficial layer of deep cervical fascia. So this is the superficial layer of deep cervical fascia, also known as the investing layer. You can see this is in the subplatysmal plane, and we do the dissection in this plane. What can you see over here? You can see that posteriorly from the posterior triangle we have the cervical plexus. Okay, remember the posterior triangle, we have the brachial plexus. From there the nerves comes into the neck, so that is the cervical plexus nerves. Then we can see the parotid gland and the submandibular gland. So this fascia, when it goes up, it encases two glands. Which two glands? You can see the parotid gland and the submandibular gland. So remember, I told you it is going around the neck, it is enclosing the sternocleidomastoid and the trapezius. It also encloses two glands, the parotid gland and the submandibular gland. Okay, right? Now we have removed the superficial layer of deep cervical fascia. So when you remove the superficial layer of deep cervical fascia, you can see the vein, the external jugular vein, you can see the sternocleidomastoid muscle, you can see the trapezius, right? You can over here also see the submandibular gland, and over here the parotid gland. Okay, now you see we have removed the fascia, and you can see over here this is the posterior triangle of the neck. So as I was telling you, the posterior triangle, the lateral aspect, you can sometimes also call it as roof of the posterior triangle, that is formed by superficial layer of deep cervical fascia. Right? Okay, now the superficial layer of deep cervical fascia, remember, it follows rule of two. What is rule of two? I have already told you rule of two. It encloses two muscles. Which two muscles? Trapezius and sternocleidomastoid. Then it encloses two glands. Which two glands? Parotid gland and submandibular gland. And then it forms two spaces. Which two spaces? Space of the posterior triangle, which I have just shown you, and the suprasternal space of Burns. Okay, so it formed these two spaces, space of posterior triangle and suprasternal space of Burns. Right? Okay, now before I end this fascia and go to the next one, let us look at this diagram. Now this is a coronal cross section. Okay, very important, it's a coronal cross section. We'll go from below up. Right? I'll take you from below up. Let's look over here. At the lowermost, you can see the sternocleidomastoid. Right? So you all can see the sternocleidomastoid muscle, and surrounding this is the fascia. Now we know which fascia is this. Okay, you can see the platysma on the lateral aspect, and the fascia is the investing fascia or the superficial layer of deep cervical fascia. So lateral to this fascia we have the platysma. Right? Okay, and this fascia is enclosing the SCM. Now this fascia also goes up. So let's see, where is it going up? You can see the parotid gland. So you can see that this fascia, it encloses the parotid gland. So when it encloses the parotid gland, it forms the capsule of the parotid gland, and inside it forms a space. That space is known as parotid space. So we'll discuss that parotid space later on, but the superficial layer of the deep cervical fascia, it forms the parotid space. Right? Okay, now what else can you see over here? You can see the masseter muscle. So you can see the masticatory muscles. So masticatory muscles, we have the masseter, we have the temporalis, right? We also have the medial and the lateral pterygoids. Now you see this fascia, it is covering the parotid from both the sides. It is also covering the masseter. Okay, and it also proceeds upwards and covers the temporalis. Basically it covers all the masticatory muscles. So when it covers the masticatory muscles, it forms a space. So the superficial layer of deep cervical fascia and the muscles in between them, a space is formed that is known as masticator space. Okay, that space is known as masticator space. Remember, we have the masseter. So around that there is a masseteric space. We have the temporalis. So around that we have a temporal space, and we have the pterygoids. So around that we have pterygoid space. So the masticator space is further divided into three spaces: masseteric, temporal, and pterygoid. We will be discussing the masticator space ahead also. Right, so let's look over here. We saw the masseter, we saw the temporalis. Okay, you can see the temporoparietal fascia that is outside, and this superficial layer of deep cervical fascia, it goes up as the temporalis muscle fascia. Okay, so it goes up as the temporalis muscle fascia that is covering the temporalis muscle. This temporalis muscle fascia, you see, it is a continuation of superficial layer of deep cervical fascia, and this is the same fascia which we use, which we harvest for the graft and we use in tympanoplasty. For the reconstruction of tympanic membrane, this is the most commonly used graft. Okay, the temporalis muscle fascia, this is the most commonly used graft in tympanoplasty for repair of tympanic membrane. Okay, so you can see that this superficial layer of deep cervical fascia, it not only is there in the neck, but it also goes up and forms a lot of different spaces, which I have just given you a out view. We'll be discussing them in detail later on. Right? Okay, let us come to the middle layer of deep cervical fascia. Now the middle layer of deep cervical fascia is also known as pre-thyroid fascia or pretracheal fascia. Okay, although the name is pre, but it surrounds the thyroid and the trachea. Right? So this fascia, the middle layer of deep cervical fascia, you can divide into two different components. It has two different components. Which one? The first one is the muscular division. Okay, the anterior one is the muscular division that surrounds the strap muscles. Right? It surrounds the strap muscles, sternothyroid, sternohyoid, strap muscles surrounded by muscular layer of the middle layer of deep cervical fascia. And then we have the visceral layer, the visceral division that surrounds the thyroid, the trachea, as well as the esophagus. Okay, so this one surrounds the thyroid, the trachea, as well as the esophagus. Now on the posterior aspect of esophagus, okay, at this level you can see that this is the trachea. Okay, behind the trachea you can see an antero-posteriorly collapsed tube. Now this tube over here, this is the esophagus. Right, but when you go up, you will find that this esophagus is replaced by pharynx. Right, so in the posterior wall of the esophagus or the pharynx, this fascia is known as buccopharyngeal fascia. Okay, so this is known as buccopharyngeal fascia that we have already discussed. Okay, so that we have already discussed the buccopharyngeal fascia, the outermost layer of the pharyngeal wall. We have talked about it multiple times in the pharynx. This buccopharyngeal fascia is formed by the middle layer of deep cervical fascia. Right, so you can see the trachea over here, you can see the thyroid gland over here, you can see the esophagus, which will be replaced superiorly by the pharynx, and they are covered by the visceral layer of the middle layer of deep cervical fascia. Okay, now let's look in this diagram. So in this diagram we earlier saw the superficial layer of deep cervical fascia. Let's look at the middle layer. So you can see around the strap muscles we have the muscular division, and around the thyroid. You can see that blue color that is around the thyroid, not just thyroid but trachea and esophagus or pharynx also, that is the visceral layer. And I was telling you that this visceral layer forms a green color. You can see demarcated fascia in the posterior aspect of esophagus or pharynx, that is known as buccopharyngeal fascia. Clear? Okay, so that was your middle layer of deep cervical fascia. Let's go and understand the deep layer of deep cervical fascia. Okay, now the deep layer of deep cervical fascia, you see over here, this is further divided into two layers. Number one, the alar fascia, and number two, the prevertebral fascia. Okay, you see the prevertebral fascia. Now this fascia is important. The prevertebral fascia, you see it encloses the vertebra. It goes all around. It encloses the vertebra as well as the paravertebral muscle, the sclenary muscles. Okay, so it encloses all these muscles, goes all around the vertebra. So that is your prevertebral fascia. Now anteriorly, the deep fascia, the deep layer of deep cervical fascia is divided into two layers. Okay, the alar fascia and the prevertebral fascia. You can see over here, they're divided into two different layers, the alar fascia and the deep cervical fascia. Okay, now remember, we just studied the buccopharyngeal fascia. So this green layer over here is buccopharyngeal fascia that we have just studied. Okay, now remember, anterior to the vertebra, we have a layer, we have a space. Okay, that space is known as prevertebral space. This prevertebral space, it extends throughout the vertebral column. All along the vertebral column, we have the prevertebral space. So from the skull base, all throughout the vertebral column, we have the prevertebral space. This is anterior to vertebra, but it is behind the prevertebral fascia. So don't be confused. This space is between the vertebra and the prevertebral fascia. Right? Okay, then you see between the alar fascia and the prevertebral fascia. Okay, between the alar fascia and the prevertebral fascia, we have a space over here. Now this space, you see, this is known as danger space. Right? This space is known as danger space. This space extends from the skull base to the diaphragm. Okay, from skull base to diaphragm, we have the danger space. Why do we call it as danger space? Because any infection, if it enters into the danger space, it will go into the mediastinum. This space ends at the diaphragm, so it will transfer all the infection into the mediastinum, into the thorax, so that will cause mediastinitis. So this space is known as danger space. Right? Okay, now let's look over here. We can see the buccopharyngeal fascia. So remember, I just highlighted this green color layer over here, that is the buccopharyngeal fascia. Okay, now between the buccopharyngeal fascia and the alar fascia, we have over here a layer, a space that is known as retropharyngeal space. Okay, so I am highlighting this space over here. This is known as retropharyngeal space. The retropharyngeal space again extends from skull base to the level of T1, T2 vertebra. Okay, now all these three spaces that I have talked about, these are not actual spaces. So before I go ahead, let me make my point clear. These are all potential spaces. Just like I told you about the peritonsillar space, these are all potential spaces. Okay, these spaces, they appear only when there is an infection or some other disease such as a tumor. Okay, otherwise these spaces are not present. So these are all potential spaces. Rather than calling them as actual spaces, they are all potential spaces. Okay, so these were the three layers of the deep cervical fascia. Now let us look in this sagittal plane. So when we look at the sagittal cross section, what do we see over here? Just anterior to the vertebra, you can see a layer that is known as prevertebral fascia, extends all along the vertebra, and just posterior to that we have the prevertebral space. Okay, now anterior to the prevertebral fascia we have the alar fascia, and anterior to alar fascia we have the buccopharyngeal fascia. So three spaces. You see, posterior to prevertebral fascia, prevertebral space. Between the prevertebral fascia and the alar fascia we have the danger space, and between the alar fascia and the buccopharyngeal fascia we have the retropharyngeal space. Okay, so these three spaces, they run all along the neck. All right, now before I end the topic of this fascia, the layers of the cervical fascia, let's look at the carotid sheath. Okay, so you see this is the carotid sheath marked in the diagram. Now this carotid sheath, look at this carotid sheath. How is this carotid sheath formed? So you see in the anterior lateral aspect, you can see that there is superficial layer of deep cervical fascia. So this superficial layer of deep cervical fascia, as you see over here, it is contributing to the formation of carotid sheath. Now, in the anterior medial aspect, you can see over here, we have the middle layer of deep cervical fascia. So you see the middle layer of deep cervical fascia is also contributing to it. And then in the posterior aspect, you can see the deep layer of deep cervical fascia. So that means all the three layers of deep cervical fascia, they combine and they contribute to formation of this carotid sheath. Okay, now inside the carotid sheath, there is a space. That space is known as carotid space or carotid sheath space. Okay, so inside this we have the carotid space. Now what structures are present in the carotid space? In the carotid space we have the IJV. So on the lateral aspect we have the internal jugular vein. On the medial aspect we have the internal carotid artery, and posteriorly we have the 10th cranial nerve, that is the vagus nerve. Okay, so they are present inside the carotid sheath. All right, so these were the different layers of the cervical fascia which we must know.